The Ministry of Health, Wellness and Elderly Affairs has issued a public advisory noting an increase in the current heat levels. The recent weather conditions are placing individuals at significant risk of dehydration and its related effects, which include dizziness, fainting spells, heat stress, and other heat-related illnesses. In response to these risks, the Ministry of Health has issued specific guidelines to protect vulnerable populations, particularly students. The ministry advises the administration and staff of all schools, as well as parents and guardians, to take proactive measures to avoid exposing students to direct sunlight during these high-temperature periods.
To avoid the detrimental effects of the heat, the Ministry of Health advises the administration and staff of all schools, parents and guardians to avoid exposure of students to direct sunlight, particularly between the hours of 10 a.m. and 2 p.m. It would be prudent to limit outdoor activity in the direct sunlight during this time. Additionally, students should be encouraged to increase their consumption of water throughout the day. Ensure that students bring water bottles to school to have water readily available. Also, students should be encouraged to take water breaks during classes. It should be noted that sugary drinks are not a substitute for water as they contribute to further dehydration.
Ensure when children are exposed to direct sunlight, hats, umbrellas, cool, light-colored protective clothing, and sunblock are used to reduce the impact of the heat.
Please be vigilant for signs and symptoms of heat exhaustion, which may include dizziness and fainting, weakness, heavy sweating, moist, sweaty skin, vomiting, nausea or diarrhea, fever greater than 102 degrees, dilated pupils, headache, rapid shallow breathing, cramps, and muscle spasms. Students experiencing any of the symptoms above should alert the school nurse or teacher immediately to get proper medical attention.
According to the community pediatrician, children are particularly susceptible to the dangers of extreme heat.
These guidelines are particularly important for the young who tend to be easily affected by extreme heat and lack the ability to regulate their body temperature in the same way as adults. Students with chronic illnesses, including diabetes, asthma, and sickle cell, are urged to take the necessary precautions during this time. For further information, please contact the Epidemiology Unit at 468-5325 or 468-5326.
While the rising temperatures are a natural occurrence, it is crucial for everyone to be proactive in safeguarding their health during this period. By taking the recommended precautions, we can reduce the risk of heat-related illnesses and ensure the well-being of our community. For Choice News Now, I am Unika McCoy reporting.